What is diabetes? With diabetes, your body doesn't make enough insulin or can't use it as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems, such as heart disease, vision loss, and kidney disease. There are three main types of diabetes. Type 1, a chronic condition in which the pancreas produces little or no insulin. Type 2, a chronic condition that affects the way the body processes blood sugar, glucose. Gestational diabetes, a form of high blood sugar affecting pregnant women. This is a condition in which the blood glucose level goes up and other diabetic symptoms appear during pregnancy in a woman who has not been diagnosed with diabetes before. It happens in about 3 in 100 to 9 in 100 pregnant women. Gestational diabetes is a form of diabetes that develops during pregnancy. It is caused by a combination of hormonal, genetic, and lifestyle factors. Symptoms of gestational diabetes: increased thirst, needing to pee more often than usual, a dry mouth, tiredness, blurred eyesight, genital itching or thrush. Here are some key factors that contribute to the development of gestational diabetes. 1. Hormonal changes during pregnancy. The placenta produces hormones that help sustain the pregnancy. Some of these hormones can interfere with the normal functioning of insulin, a hormone that regulates blood sugar levels. This hormonal imbalance can lead to insulin resistance, where the body's cells do not respond effectively to insulin. 2. Insulin resistance. Insulin resistance occurs when the body's cells become less responsive to the action of insulin. During pregnancy, the increased production of certain hormones can make it harder for insulin to do its job of regulating blood sugar levels. As a result, glucose, sugar, accumulates in the bloodstream, leading to gestational diabetes. 3. Genetic predisposition. A family history of diabetes can increase the likelihood of developing gestational diabetes. 4. Excessive weight or obesity. Being overweight or obese before pregnancy increases the risk of developing gestational diabetes. The excess weight can contribute to insulin resistance, making it more difficult for insulin to regulate blood sugar levels effectively. 5. Ethnicity. Some ethnic groups have a higher risk of gestational diabetes. Women of African, Hispanic, Asian, or Pacific Islander descent are more likely to develop gestational diabetes compared to women of other ethnic backgrounds. 6. Previous gestational diabetes. If you had gestational diabetes in a previous pregnancy, you are at a higher risk of developing it again in subsequent pregnancies. 7. Age. Women who are older when they become pregnant, typically over the age of 25, have a higher risk of developing gestational diabetes. As women age, the body's ability to process insulin may decline, increasing the likelihood of developing insulin resistance. It's important to note that gestational diabetes usually resolves after childbirth. However, it does increase the risk of developing type 2 diabetes later in life. Managing gestational diabetes through proper medical care, a healthy diet, regular physical activity, and monitoring blood sugar levels can help minimize complications for both the mother and the baby.